Probably the most common question we get about ankles and arthritis is how can you treat ankle arthritis? Unfortunately, that's a difficult question because there are so many problems and so many treatments. I'll condense it here and then we can talk about individual ones on other videos. But basically, there's a local problem and then there's systemic problems. And I won't talk much about systemic problems, which are in that category of lupus, uh, rheumatoid arthritis, psoriatic arthritis, and many others, but those should be treated by your primary care, internal medicine, or endocrinologist because they involve heavy testing and different types of drugs which have side effects. Now, you've seen a few on TV lately, and those are much better with less side effects than the old granddad, which was cortisone, but that's still used to this day, and methotrexate, which is also a more aggressive medication. Locally is my world. We'll touch closely on that one and quickly, and that is your anti-inflammatory world. You can't beat Advil and Naprosyn just to get by at the end of the day, especially when you have your flares. Uh, Ice and elevation, support stockings, those are all local help. I don't know if ankle braces and cam walkers are really treatment, but if you're having a bad flare up and it just simply hurts to move your ankle, you can't get by, we give those out in the office, which help out a lot until we can get to the root of the problem with other testing. And that involves CT scan or MRI. And if you do see a cartilage lesion or subchondral fracturing, which is a bone underneath, usually the procedure of choice is the arthroscope. And arthroscopically, you can look inside the joint, of course. MRIs do miss things from time to time. So with pain and a few cortisone injections in the office, which of course is another option, these we use diagnostically and also patients that are having severe pain just to get them through a day or through a week, but that's not long-term care, of course. Back to the arthroscopic procedure, the great news is not only can you debride any debris, things floating around, things of that nature, but we have biologics, and these biologics come in the form of things that can help heal the cartilage itself. You've heard about stem cell therapy or amniotic solutions, but there's also liquid bone or calcium phosphate that you can inject underneath for subchondral fractures. So ankle arthroscopes are very exciting because we can repair things that we couldn't repair back in the past. More on the aggressive level, when the arthritis gets bad enough and there's really no cartilage left and you've run out of options and arthroscopically you can't really fix anything, there are ankle joint implants. There are several of them out there, but you have to be a good candidate for them. I won't go through the criteria, but your foot and ankle surgeon will go over that with you. That retains the motion, but like I said, for some people, it's not a good option. Lastly, there's an ankle fusion. It's daunting, it sounds scary, but sometimes an ankle fusion is much better, especially if you're not a candidate for an ankle implant. And I've had patients before with severe pain and tried and failed at several treatments, and once the ankle was fused, they had no pain at all, they functioned just fine. Again, a joint that doesn't move is a joint that doesn't hurt. If you have any other questions, you can leave them in the comments section. And again, I hope this was hopeful. Thanks for tuning in. Stay healthy and one step ahead.